When you deliver a medical intervention at scale, a statistical rarity becomes a certainty. Every intervention at scale has the potential to hurt some kids. You absolutely will. There is no way around it. Well, the measles vaccine is only available in the United States as the measles, mumps, and rubella vaccine. It's a combined single shot. It's been given that way since 1971. Diphtheria and pertussis are only sold in a combined shot along with tetanus. You can't get it without it, even though they all are very different diseases. They all have aluminum, and if you don't put aluminum in them, you can't get vaccinated against diphtheria or pertussis. Aluminum is different, and it's in a class that's called an adjuvant. It's not the only adjuvant that's there, but it is the one that is best studied, best known, and cheapest. So what an adjuvant does is a couple of things. It kickstarts the vaccine in the body. The other is it acts like a depot. So it basically lets the vaccine, when you get that dose, the dose of the vaccine doesn't get delivered all in one day. One of the challenges with aluminum, it is a known toxin. There is no dose that is inherently a good dose, but there are lower doses. We don't have human studies. We wish we did. But there are animal studies that basically say at a low dose that aluminum generally, as an adjuvant, is probably pretty safe. Really lethal diseases, diphtheria, pertussis, without an adjuvant, the vaccines don't work very well anymore. This is the trade-off. It is the addition of a toxin. There was a study by the CDC that looked at aluminum a few years ago, and they found that in the United States, where we have, depending on what numbers you want to look at, we have minimum 40% more than Denmark, but as much as 100 to 150% more. We have a lot more aluminum. So when they've looked at the amount of aluminum, there was a 26% increase in the risk of developing asthma. When you give these toxins, this is not arbitrary. It's not like people are trying to poison kids by giving adjuvants. They're trying to get the vaccines to work. There are other adjuvants that we've been looking for, other kickstarters. We just haven't found one that works quite as well. So it is an imperfect solution to the very real problem of some very contagious diseases. In the United States, we often get outbreaks, but the only way you can get the vaccine is as a combined shot. So we give 5 shots, but we don't give 5 shots because you need 5 shots of diphtheria, and we don't give 5 shots because you need 5 shots of tetanus. We give 5 shots because we need another 2 shots of pertussis to deal with the outbreaks. And the idea is, well, maybe we will protect our kids, but then we set up our kids for actually extra aluminum exposure. We can't give them that extra shot of pertussis because we don't make it as a single shot. We don't have the option for a parent who says, you know what, I get that the baby needs this, but I'd really like to space these out a little. I'd really like to give measles, and then I'd like to give mumps, and then I'd like to give rubella, because I'm a little nervous about this. If a parent wants to actually very logically deal with one disease at a time, they don't have the option. Measles, when you have a horrible outbreak, can kill 1 in 1,000. Population level, you understand why people are scared about measles. Pertussis, up to 1 in 100. You understand why people are scared about pertussis. Diphtheria, 1 in 10. Generally speaking, varicella is pretty mild. When we think about the varicella vaccine, they said, well, the death rate's 1 in 100,000. So it's not lethal in the same way as the other ones that have traditionally been part of our herd immunity vaccine. We have probably, generally speaking, saved between 50 to 80 lives a year since we have had the varicella vaccine. Those are kids, those are real children who did not die, and that's definitely an important thing. But there often are consequences in nature when you deal with something that's not necessarily lethal to the population. So what happens is we've had this big increase in shingles in older people. So this is the trade-off, and I think all of medicine, all of public health has trade-offs. What are vaccines best at? eradicating disease, breaking transmission, preventing disease, and saving lives. Ultimately, this is what we hope, right? We hope to save lives, and we hope to decrease morbidity, the sickness, and the burden of disease. But there's a lot of economics in it, and in so many ways. So let me start first. I want to talk about bundling, because that's part of it, and the populations you need in order to make vaccines financially viable. When you look at the measles, mumps, and rubella vaccine, the original idea of this is that you were going to have a vaccine that was going to limit the number of shots that a kid got, right? And that's a good thing. We used to be able to get these single shots, but not everybody wanted to do this. There was a lot of politics that went back and forth, and so the market for it was pretty small. There is a manufacturer who was making the single shot alternatives. They actually still have the formula here in the United States, in theory, to get these, but they just said it wasn't economically viable for them anymore. Part of the reason we don't have single vaccine alternatives, I'm not weighing in on whether they are good or bad. This is just an economics decision that you would have to demonstrate a market in order to even have a discussion with a manufacturer at this point. The final economics piece, I would say, that really fascinates me is hepatitis B. Hepatitis B gets spread if mom is pregnant, has hepatitis B, and she passes it to baby during delivery. The next way that we spread it depends on two things, and it's called horizontal transmission. There is a report of a single 4-year-old who was a biter. If you ever send your kid to daycare, you will know that there are biters. There was one kid he especially liked to bite. And this kid ended up getting hepatitis B. We have one case in all of the published medical literature. Now, think about that real kid who got this. But also think about the real kid who was the biter. These are tragedies on both sides of it. But in the United States, where we never really had horizontal transmission, public health authorities said, but there was a biter. Now, no place else in the rest of the world is this a way that we see this disease spread. But then that becomes a justification for, well, horizontal transmission can happen. It doesn't happen with caregivers in the United States because we have good sanitation, and the way that most people get hepatitis B is IV drug use. But there is this concern that public health authorities, well, we have this one case. In the time from that case to the time we had universal vaccination, about 60 million kids went to daycare. And there's never been a replication of that case in the United States. That was not seen as reassuring enough, so this becomes the justification for not just the 3.6 million kids who are getting the birth dose, but the additional 7-8 million who are of an age where they would be eligible to get the hepatitis B vaccine, ostensibly to prevent horizontal transmission. Now let's talk about a market. Right now, about 98.5% of all women actually get a screening for hepatitis B. It's a routine lab test that women are going to get done. They get it done along with a bunch of other tests during pregnancy. We still have 1, maybe 2% of women who don't get screened. So we have a group of women, really small group, but again, 3.6 million versus, so 1% is not nothing. We have these kids who get this, so if we have 3.6 million kids and we just stop there, that's a market of 3.6 million kids. But if we only do 1%, what's the market there? That's 36,000 kids. And if we do the 1 or 2% who didn't get the screening and we don't know their status, that gives us a market of around 70,000 kids. So I'm going to ask, what's more profitable? Vaccine acquisition for a market of 70,000 or vaccine acquisition for a market of 11 million? Because right now, the economics are, we have a market of 11 million if we vaccinate all kids at birth, even if mom tested negative, $500 million on acquisition of vaccines, and if we do it universally, it's $50 million if we do it in a targeted way. And we have the economics of a captive market of 11 million kids. It's hard to give up a market. Vaccines to me are such a great public health success story, and there are so many kids whose lives have been saved, and there are so many kids who have had less impaired lives, who have been spared different consequences of diseases. I don't think we ever want to lose that. We have to get an emphasis on the herd immunity vaccines, on the Category 1 vaccines. We are treating, if everything is equal, nothing is equal. If everything is a crisis, nothing is a crisis. We have situations where moms are wanting to have some flexibility in the schedule, wagging your finger at a parent and saying, you can't have any flexibility and you're a bad parent. Guess what that gets us? That gets us kids who are opted out of the system completely. I'm hopeful because of parents, because, as a profession, as physicians, as public health leaders, we've often in the past been able to gatekeep information, and I think parents do have access to information in a different way. And I think parents are informed, and I think parents can be advocates for their kids, and more of them are being that. My greatest hope is that kids are resilient, that we have an opportunity to better serve them. And that is, I think, ultimately, this is why I'm doing this work, is that can we better serve our kids? I think that we argue a lot. I think our polarization, we have very loud voices sometimes in extremes, but I actually don't think we're as far off from each other as sometimes it might seem. The information that I provided in this video is not intended to be medical advice. It's my opinion based on my research and review of the literature, but it's not about your individual medical situations. If you have medical questions, I would strongly encourage you to reach out to your own healthcare providers to make those decisions.